We now have a lot of cervical cancer vaccines available in the market. There are different types: Cervarix, Gardasil 4 and Gardasil 9. And depending on the vaccine that is used, the protection from the different strains of HPV viruses varies. For Gardasil 4, there is protection for about 4 viruses, and for Gardasil 9, there's protection for about 9 viruses. The age of administration for this vaccine ideally is for children. So we can start vaccinating both boys and girls from the age of 9, and ideally they should be vaccinated before the age of 15. Within this age group, they would only require 2 vaccines. That is given if they have a vaccine today, a second vaccine 6 months later, and that would keep them protected from the HPV virus quite reasonably well. If the child is over the age of 15, then they would require up to 3 vaccines. Similarly, now the guidelines are encouraging women up to the age of 45 to take the vaccine. However, what is important to note is that it varies, the efficacy of the vaccine varies from person to person. It works best in a person who is not yet sexually active, or in someone who's only been recently married, like a year or 2 of marriage. It's okay to use the vaccine. Even though the efficacy is lower, it would still have some efficacy. If, however, a woman has been married for 15-20 years, been sexually active for that long, has had pregnancies, then she has invariably been already exposed to the HPV virus. So the benefit that she's going to get from this vaccine is extremely limited. So what is more advisable for these women is that they need to get their pap smear test or the LBC smear test done quite regularly, minimum of every 3 years. Depending on their family history and personal history, sometimes we might have to do the smears a little bit more often as well, but it is very important for them to see a gynecologist and get their smear test done regularly.